Hey everyone, it's Dr. Jamie with True Health Chiropractic. We are so excited that you're here with us tonight. If you're new to the office, if you've never been on one of our workshops before, we bring you a different topic every month. Our focus tonight is going to be how to actually calm your anxiety. Next month, we're going to be focused on sleep. And then in October, we're actually going to be talking about cancer prevention. So please stay tuned. Join us every single month for these workshops. Right now, in the current situation, we're bringing them live through our Facebook page and also on our YouTube channel. These are things that you can share with your friends and your family members. There's no better way to stay in touch with people with technology today. And so we're excited about being able to bring you this workshop in a different way. But too naturally, because we're not face-to-face with you, if you've got questions, you can drop them in the comment section below. If we're not able to get to them as we're going live through the workshop, we will absolutely answer them later. But like I said, we are so glad that you are here with us. Please join us for our next upcoming workshops as well. And our focus tonight is going to be how to calm your anxiety. Because of what's going on in the world today, it's been going on now for months, but we are literally seeing so many patients asking questions about really kind of just how to reduce some stress, manage some of the anxiety and some of the fears that they have about a lot of the unknown decisions that they have to make. Whether it's sending your kids back to school in the next coming weeks or month, if it's just the fact that you're completely out of your routine, you may have even lost your job, you may be worried about income and things like that. There's a lot of things that people are stressed and they're anxious over. And so this is a great topic that we want to be able, and we're excited to bring to you. But like I said, please do share it with other people. And our mission, just one of our missions at True Health, is to continue to engage you, help teach, guide you so that you can make the best decisions toward truly not just getting your health back, but ultimately staying that way. And so part of truly being healthy is learning and understanding how the body functions and getting it to function at 100%. So I'm going to share my computer screen with you. Like I said, if you have questions, please drop them in the comments below, and we'll be answering them as we go throughout the workshop. And if not, we will always reach out to you later as well. So I'm going to share my computer screen and we're going to get started. So the topic tonight, like I said, is how to actually calm your anxiety. One of the, a lot of people, this is actually the most common, it's the largest neurological disorder in the United States. It's a huge problem with nearly 20% of Americans actually suffering from some sort of anxiety, whether it's full-blown depression, generalized anxiety disorder, panic disorders, phobias, social anxiety disorders, obsessive compulsive disorders. These are just different specific diagnoses that overall state the fact that currently Americans are suffering from a panic state of anxiety. And this is really kind of, it's a fear of the future. It's a fear of the unknown. It's especially difficult when you're faced with a challenging task. And that's normal. It's normal to actually feel a certain amount of anxiety when you don't know what the future holds and you're nervous about making decisions and having to come up, like I said, you're faced with a challenge. What's not normal is our reaction where it's out of proportion or we're just overly anxious and scared about something that honestly probably may not even happen. So it's a lot of times more our reaction and what internally is actually happening that is not a normal response to that fear. And so there are three different types of stress. I think this is key to kind of better understanding and breaking this down. So what are kind of some daily action steps we can take to help us in these three different aspects of stress that we're going to experience that can then lead to states of anxiety or depression? So the three different types of stress that we all experience are chemical, mental, and physical. And again, there are only three types of stress. And so again, if we break these down, what we want to focus on is how can we take some daily action steps to reduce or have a better response to these forms of stress. Chemical stress. They've looked at, and this is even a statistic or a quote from the Environmental Working Group, back in 2005. They actually now still find way more chemicals than were even detected at this point in time. But what they were looking at was different chemical amounts that they were finding in the umbilical cord of newborn babies. And of the 287 chemicals that they detected, 180 of them were already known to cause cancer in humans and animals. 217 were toxic to the brain and nervous system, and 208 caused birth defects or abnormal development in animal tests. So point being, we are exposed to chemicals on a daily basis from the food we eat, the products that we use. These are why we do workshops. This is why we talk about toxicity and detox. But this is a form of stress that we are all underneath. And so absolutely, making better decisions in the products that you use and the foods that you eat, not eating GMOs and eating organic fruits and vegetables definitely will help. And that's a part of what the key is when you're looking at here. Of the 287 chemicals they detected, 217 of them were toxic to the brain and nervous system. Anxiety is a neurological disorder. And so in order to help your nervous system respond better to stress, just one thing that we can focus on, again, is removing some of these chemicals in our lifestyle, in our diet. The other stress is mental stress. 49% of the general population has a history of anxiety, depression, substance abuse, or some of all three of these major problems. And so, in fact, people with a panic disorder, they're also more likely to have mitral valve prolapse, hypertension, peptic ulcers, diabetes, chest pain, and thyroid disease. In fact, men who have anxiety disorders, they're also at greater risk for cardiac disorders, hypertension, gastrointestinal disorders, respiratory illness, asthma, and back pain. And women with anxiety disorders are more likely to have a history of cardiac problems, hypertension, metabolic, hormone disorders, respiratory disorders, GI distress, skin disorders, and arthritis. So again, the mental emotional stress is real, and it's arguably the worst because it leads to over 80 to 90% of diagnosed conditions and disorders because of the current state of mental stress that we're all under. This is something we're all being exposed to. The average high school kid literally has the same level of anxiety as the average psychiatric patient did in the early 1950s. This is a huge problem. And again, we're being faced with things even now that none of us are used to experiencing. We don't know how to handle some of the things that we're literally seeing every single day on the news, reading in the paper with COVID-19 and the pandemic, and people being scared and not really knowing, what's going on. Plus two, it's confusing. Every other day, the statistics are different. You don't know what you can believe and what you can't believe. And this creates larger amounts of anxiety because, again, of the unknown. So part of what we can do, we're going to talk about key strategies to how to deal with some of the mental stress. The other aspect of stress that we all experience is physical stress. So anything from sitting, using technology, even the birth process is a physical type of stress. And it's been said numerous times that sitting is the new smoking. A lot of us are on computers. We're using certain forms of technology. Not only do we typically tend to have sedentary forms of a lifestyle, which creates more compression to the disc and to the joints and spine, but also it fatigues your muscles. It's kind of that concept, if you don't use it, you're going to lose it. Also, what we tend to see is that the joints, because when you sit, you also tend to be dehydrated, you tend to not drink. So this leads to further advancements of arthritis, not just in the spine, but your other joints as well. Technology such as cell phone use. This has greatly increased even too with the amount of people working from home. And now a lot of the kids going back to school are not even going to be going to school. They're going to be doing virtual learning on the computers, on their cell phones, on their iPads. And we tend to have a lot of what's called forward head posture. Almost 80% of the population between the ages of 18 and 44 have their cell phones with them almost every waking minute with only 2 hours of their day spent without them on hand. And this new trend leads to an entirely new actual diagnosis that they've come up with called text neck. Spine surgeons have been noticing a rise in patients in their office complaining of neck and upper back pain because of the extensive cell phone use and posture changes. These posture changes actually cause consistent changes in the aging spine, but now they're being found in younger groups. And this actually does increase the weight of the head. So when your head is flexed forward, it actually can increase the weight of the head anywhere from 27 to 60 pounds. This is what then leads to not only neck pain, but literally pain all the way down into the pelvis and in the lower back because of the increased weight on the head. So again, certain things, especially when we talk about a corrective spinal adjustment, staying on track with your adjustments and making sure the spine is in proper alignment and working on healthy posture is a way to actually reduce this physical type of stress on the nervous system. And then, of course, the birth process. This, again, is something that every single one of us has been through. Also, too, what a lot of people don't realize is that positive things in their life are forms of stress. So buying a new house, having a new baby, getting married, having a new job, these are all exciting new things, but look at all the different things that come with those. A new house, mortgage payments, more bills. You got to buy new furniture, more money, more bills, repairs, lawn maintenance, taxes, weddings. You got to send out invitations. How much does the venue cost? Making sure everybody shows up on time, that you get your dress and your tuxes, all these different things. A new baby, not sleeping, changing diapers, less freedom, cost, bills. And then a new job, a change in your schedule, dealing with new coworkers, being trained in a new position. These are all forms of stress that can lead to, again, heightened states of anxiety and sometimes even depression. So again, it's key though, really is how is our nervous system going to respond to these forms of stress? And that's what we're going to talk about in a second. So some of the symptoms of stress, full-blown actual anxiety, allergies, respiratory issues, high blood pressure, trouble sleeping, chronic immune system issues. Again, even more important, people that are worried about COVID-19 and the virus and different things, it's even more important to reduce your stress so that your immune system stays strong. Infertility, even pain is actually brought on by forms of stress. And so the key with our nervous system, this is your master control center. This is your brain, your spinal cord, every nerve root in the body. And the function of your nervous system is to perceive your environment and then coordinate the behavior of all your other organs, tissues, and cells. So for instance, when a stress, like I said, getting married, having a new baby, it's the job of your nervous system to perceive that stress and then get the other organs and tissues to respond appropriately in what we would call typically your fight or flight response or rest and digest. So essentially, if you want to think about it in an easy way, your nervous system, you can kind of divide it into two. What the preferred state to be in would be this rest dominant, a parasympathetic dominant state in our nervous system. This is when we can sleep. This is when we can relax. This is when our hormones are balanced, and recovery also from injury as well as increased digestion happens in this state. As the exact opposite, if you tend to operate in what we call a fight or flight or a stress survival mode, you're going to have the exact opposite of rest and relaxation. You typically would have increased blood pressure, stress hormones that are elevated, weight gain, inflammation, pain, headaches. Your immune system is weak because your body is in this fight dominant state. And so it's kind of like your nervous system is perceiving that there's a bear or a tiger in the room all the time, even sometimes when there isn't. So what we really want to find is a key balance, but at times we really want to be more in a rest dominant state. So 3 keys to supporting your nervous system to reduce the negative effects of stress. We're going to go over actually more than 3 keys, but again, what we want to focus on are those 3 different types of stress: emotional, chemical, and physical stress. So one way we can combat emotional stress is just being thankful, literally making a list of gratitude. Write or type out daily things that you are actually thankful for, and things that you have gratitude for. You can also do something that's called a 15-minute morning triathlon. And so this is broken down into 5 minutes apiece, 5 minutes of reading, reading something positive, reading your Bible, doing a Bible study, reading something that's going to bring you hope, something that's going to fill you up with some positivity. Do not watch the news. Don't read the newspaper. You don't want to read things that are negative. But 5 minutes of reading, then followed up by 5 minutes of talking, just maybe reading your list of things that you are grateful for, people that you're thankful that are in your life, praying, and again, just taking 5 minutes to talk out loud. What this does is you're setting some different neurological pathways. There's a power to one, reading, but then also speaking and talking so that you can hear. And then the last is 5 minutes of just being quiet, taking some quiet time to reflect on the things that you read, the things that you prayed about, the things that you said out loud, the list that you made, and just listening for that, quiet, still voice. Again, just helping to reduce some of the emotional stress. It's also key that I don't have on the side, but I've talked about this before, is doing a particular breathing pattern called 4 squared breathing, where you actually breathe in through your nose for 4 seconds, hold that breath in for 4 seconds, then blow it out for 4, and hold it out for 4. And you repeat everything, like I said, for a count of 4 seconds. Breathe in, then hold, breathe out, and then hold out. And this actually helps, again, your nervous system get into more that calm, rest and digest dominant state that will really help you, especially when you're in even some key moments where maybe you feel like your heart rate's going up or you feel some anxiety. It's really key to really do that breathing pattern, because you're not always going to be able to pull out a piece of paper and read the things that you're thankful for or make a gratitude list. So again, breathing is something you have to do, and that controlled breathing actually helps to slow down the nervous system. The other form of stress, chemical stress. So we want to give our nervous system the nutrients it needs in order to be able to function and combat some of those chemicals that I was talking about. Number one is going to be to eat good, healthy fats, nuts and seeds and avocados and coconut oil, dark chocolate. As long as it's over 70% cocoa, these are good, healthy fats. The majority of your nervous system, your brain in particular, is composed of fat. This is the number one missing nutrient in the standard American diet, because we're actually told the exact opposite, right? We're told to not eat fat. We're told to eat low fat, low calorie diets and foods. And that concept doesn't work. There is tons of research showing that when people eat nuts and seeds and avocados, it helps with everything from depression to anxiety to overall those other forms of stress diagnosis that I talked about earlier. Vegetables, eating foods that were once living, that live, raw foods are always the best for you. Foods that are rich in your B vitamins and magnesium, such as your dark leafy greens, again, seeds and nuts, grass-fed beef and chicken. These things are all high in B vitamins and magnesium that are really key to reducing and getting the nervous system in that calm state. So just some things you see here: blueberries, turmeric, salmon, walnuts in particular, and then fermented foods that you see in the corner, like sauerkraut and different cabbages. These are a great source of B vitamins. B vitamins also trigger what's called methylation, which actually helps you repair your own DNA. And so when you can repair and when you methylate, it actually does significantly help to reduce brain disorders, not just anxiety, but also to regulate your mood and help to reduce symptoms of dementia and Alzheimer's. Salmon, again, like I said, is a extremely good fat. And so, again, you can see a lot of people probably don't sit around. It's not one of the main things that they would eat, even in one meal, like, throughout the week. So that's oftentimes why, and I'm going to talk about in a second, some supplements. A lot of times most people actually need to supplement their diet with magnesium and with omegas, especially when it does come to stress and pain and inflammation, because again, these are not typical things that people tend to eat a lot of. The other part is that physical stress. So one, moving your body, walk, run, swim. You've got to move your body in order to keep it healthy and keep it strong. There's tons of research that shows that exercise helps to reduce stress, helps to reduce depression. I'm definitely a firm, component. If you can get outside and exercise, that's even better, because you can get fresh air, get oxygen, get sunlight. All of those things as well are important to help reduce anxiety and help reduce depression. But just moving your body, period. Not everybody is able, especially right now with how hot it is. You're not always able to get outdoors. And so, and then even too, with the virus, maybe you're not even able to go to a gym. So being able to just do some simple things at home. Everybody can do push-ups. You can do jumping jacks. You can do squats and lunges. These are things you do not need a gym. You don't need equipment to do. You can do basic functional movements, and you can move your body every single day. And like I said, there's so much power to reducing this neurological stress on your nervous system by getting your body and actually moving your joints. Two, it helps with pain. If you don't feel good, I know sometimes the last thing you want to do is move and exercise, but it actually does help to lubricate your joints and the discs in your spine. Having proper posture, especially if you sit for work, or you just tend to be very sedentary throughout the day. Having proper lumbar support in your chair is huge, because it's actually going to help to bring your head and your shoulders back and produce that proper curvature that we're not just looking for in your lower back, but also in the neck and between your shoulder blades. You want to have your head neutral or even slightly up with your chin up. And so you want to place your computer screens in a place that's going to allow for this proper head posture to eliminate the picture that I showed you earlier with forward head posture, or what they call text neck, where your head is down in flexion and forward. Also increase your water consumption. This hydrates your muscles, your discs, and it actually forces you to have to move, because you're going to have to get up and go to the bathroom. And so increasing water consumption is key to reduce pain, reduce anxiety. The body needs water in order to actually survive and function properly. Some key supplements. Again, a supplement is exactly what it is. It's to supplement your diet and your lifestyle. It is very hard in particular to get magnesium and omegas, which are good healthy fats. These are not key nutrients that people get a lot of in their diet. It's estimated that over 80% of adults are actually deficient in magnesium. And it's so important. It's an important cofactor that's literally involved in over 300 bodily processes, everything from synthesizing protein to building muscle mass and strength, controlling your blood sugar levels. Also, it controls part of how your muscles and your nervous system actually function. So everything from pain, muscle spasms, Charlie horses, restless leg syndrome, neuropathy, numbness and tingling. These are some key warning signs that you more than likely are also deficient in magnesium. The form that we specifically carry in the office is a buffered chelate. This is highly digestible, and it's also highly absorbable, and that's the key. There are different forms of magnesium. You're going to see citrate and malate, calcitate, chelate, and so essentially why we carry it in particular, this buffered chelate form, is because it's the most absorbable and it's easily digestible. And so again, this is key. It's key for great sleep, heart health, diabetes, osteoporosis, stress, anxiety, ongoing wellness. Been shown numerous things to decrease inflammation, boost your immune system, help with constipation, and again, depression and anxiety. Like I said, this is besides some of the other key supplements that we carry in the office, the magnesium is one of the number one things that we see most people that they need to supplement with this because they are deficient in it, because either they just don't have a good diet, but also, again, because our diet is so depleted in these nutrients, and magnesium is one of them. So taking a great quality form of magnesium is key. Also, omegas, basically your good healthy fats. Like I said, this is the number one missing nutrient in the standard American diet because you're told to avoid fat. You're told that it clogs your arteries and that it makes you gain weight. Bad fats, yes, do that, but good fats do not. And key, your omega-3s are loaded with things that help your brain function better. There are numerous studies showing that omegas boost your immune system, help you fight infection. They actually support your hormones, the basic building block of every hormone, testosterone, estrogen, progesterone, and on and on and on. The basic building block of that is fat. And so especially when you take a statin or a cholesterol drug, we know that you're going to have lower forms of omega-3 in the body. So this is another key supplement that we talk about, but in particular when we're talking about anxiety and depression, the majority of your brain is composed of fat. So we need to be giving the brain exactly what it needs in order to combat the physical, emotional, and chemical forms of stress that we're all under. This also helps your bones, joints, skin, teeth, colon, and digestion because, again, the basic building block of every cell is going to be having good, healthy fats in the body. So this is a key nutrient, a key supplement. The last thing is a subluxation. So remember, a subluxation is when a joint in your spine is misaligned and it creates direct interference and irritation to the nervous system. And so these are not dislocations. These are not huge misalignments. A subluxation is a very small misalignment. And again, that's, our focus chiropractically is to make sure your spine is in the best position, that it's healthy, that it's moving well. Because your spine is the closest thing, actually protecting your spinal cord and nerve roots. So it makes sense that it's supposed to be healthy. It's supposed to be in the right position. It's supposed to move properly. Also, too, when we talked about those key aspects of posture, when we're making sure and working to get your posture in a better balanced position, we know there will be less stress on the nervous system, and then your brain and body can focus again, right, coordinating all those other organs and tissues and cells, how to respond appropriately to stress. Because when your spine is out of alignment, your nervous system, it's not fully capable to be able to appropriately manage stress, right? So if your nervous system constantly thinks there's a bear in the room, we're going to get a completely different physiological response, where what we don't want to be is in that dominant fight or flight where adrenaline and cortisol and insulin and all these stress hormones are running. These things lead to pain, headaches, numbness and tingling, inflammation, pretty much the basis of every diagnosed disorder and disease. What we again want to be in, right, is that rest and relaxation state where our body can focus on healing, repairing, because you're not going to get away from a certain amount of stress. You cannot change some of the things that are going on. So what you've got to response, the action steps that you take to, for one, reduce the things that you can, right? Not eating as much sugar, cutting out the chemicals that you use and the products that you use and the food that you eat, to managing your time, being grateful, not watching the news. Those are all things that you can do to take action to reduce some of these things. But at the end of the day, there's always going to be a certain amount of things that are stressful. So again, it is normal to have anxiety about the unknown, about the future, about a challenge that you're facing. What is not normal is the prolonged and sometimes exaggerated response to not knowing what's going to happen. And that's what the key is we're trying to take action on a daily basis. This is something that's even more important right now, is literally, again, some of the key things that you can do. These may even seem silly, but the people that do these are the people that do not become overwhelmed. And so again, when you're taking daily action, taking just that 5 minutes in the morning to write a list of the people and the things that you are grateful for, that you're thankful for that are in your life, your health, your children, your family members, your neighbors, whatever it is. Those are things that you need to remember with all the other chaos that's going on. You need to read and watch positive things and surround yourself with as much positivity as possible. Do not watch the news. It's got nothing positive to tell you. And so we want to make sure we're filling our minds, our eyes, our ears with the most positive things that we can. Remove some of those chemical stressors, like I said, getting rid of some of the products that you know that they're just loaded with chemicals and perfumes and dyes and everything else, and trying to clean up some of the products that you use, and try to eat organic fruits and vegetables. Spending a little bit more money on something to make sure that it doesn't have pesticides and herbicides and all these other dangerous chemicals. And then removing some of those physical stressors, right? By exercising, stretching, moving your body, staying on track with your adjustments, working on your posture. These are all great things that we can do to keep removing some of those stressors even completely, to better help us actually calm our anxiety and focus on what's important, which are the things that we've got in our life that we can be grateful for. Remember, like I said, every month we do a different topic. I hope that you join us for next month. Our topic is going to be sleeping sense, talking about some key strategies that you can do to sleep better. One of the number one things you do when you're sleeping, just even what we talked about in this workshop, is that you actually heal and you recover and you repair when you sleep. So when you don't sleep, we know the body isn't going to be able to function at its prime at 100%, and that's what true health is. So we're going to be doing that workshop on Tuesday, September 15th at 6 p.m. Again, it will be live through our Facebook page, on our YouTube channel, so we hope that you join us for that. And then just remember is that even after we do these workshops, the videos and the workshops are still available on both of those pages. So again, I want to thank you guys so much for being here, being a part of the talk tonight. Like I said, any questions as we were going through, if we weren't able to answer them, we will definitely be going through the feed so that we can answer those. And again, I want to thank you so much for taking the time to be here. Our mission, again, is to help you stay healthy and well. And so the more that you engage, the more questions that you ask, you're always going to get better results that way. And that's what our mission is to just help you as much as possible. Again, I want to thank you so much for being here. Please share this with other people, and we look forward to